Rural doctors and hospitals tend to have less experience delivering babies, especially in complicated or high-risk pregnancies. But soon, Community Memorial Hospital in Cloquet will be able to train doctors and nurses in Greater Minnesota, giving them more experience delivering babies. How will they do it? Rick Brewer, the CEO and administrator at Community Memorial Hospital, is here to explain. Rick, thank you very much for being here tonight. This is fascinating. This is live birth simulating equipment. What does that include?
Boy, thank you for letting me.
It's almost a mother.
It really is. Thank you for letting me be here. We're so excited to start talking about this. This simulation equipment really can replicate almost every conceivable normal obstetrical, medical, and surgical scenario that you could envision. So from the straight up vaginal delivery, covering a number of different presentations and nuchal cord and shoulder problems and all kinds of things, to working through C-section scenarios, looking at fetal extraction, vacuum-assisted deliveries, all the way to hemorrhages, postpartum hemorrhage, bleeding situations, and emergency hysterectomies. You really can cover a full gamut of things that both physicians and nurses and other providers can all work through.
I would imagine this kind of training with such a sophisticated piece of equipment can do nothing but assist mothers and babies into a successful live birth.
That's exactly right. You know, what we find and how you would introduce this piece is exactly right. There aren't as many babies being born in these rural areas. Rural communities want to be able to offer obstetric services, and the ones that still are, it's really important to them. It's not a financial consideration.
Yeah.
OB doesn't pay for itself. That's not why we do it. We do it because we know it's important.
Sure.
We know that all else being equal, the farther a mom has to travel, the worse the outcomes are for mom and babies.
How was Cloquet Memorial chosen to do this?
We pursued this. This has been a mission of mine for almost 5 years. We can go all the way back to a doc we hired who needed some proctoring, just needed some extra deliveries under her belt, and we struggled to find places we could send her to kind of be immersed. Small places were more willing to help than large places, but they didn't have a lot of babies either. So we pivoted at a certain point to simulation equipment, and we found the world has dramatically changed since Resusci Annie in 1960 came out. Yes, that was 1960.
Wow.
So now you really can get a true lifelike experience in obstetrics. Studies have shown that medical students coming through with this kind of training actually outperform their classmates if the traditional training is backed up and complemented by this simulation training. We want to take providers already in the field, these physicians, these nurses, these other folks at hospitals delivering babies and non-birthing hospitals, and give them the opportunity all across rural Minnesota to come in and get high-value, low-cost training. So we chased this down, we reviewed products, we chased funding. This is outside the reach of a rural hospital on its own.
So will all the training be done in Cloquet then, and healthcare providers will come to Cloquet to be trained?
That's correct. And we've lined up so docs and nurses can get continuing medical education. We have received grants to fund all of the equipment up front. Blue Cross Blue Shield of Minnesota has paid for that. The Office of Rural Health through the Minnesota Department of Health is helping us with ongoing expenses.
I have time for one more quick question.
Sure.
So who does the training then on the simulator? A physician from St. Cloud, from Cloquet?
We will have physicians and nurses and OB nurses who are going to be trained as trainers to run these simulations. So they'll be training all of these docs and nurses and EMS providers all across the state able to come there.
Rick Brewer, this has got to be terribly exciting for you and for your hospital.
It very much
it will
is.
be for the public.
I'm a rural kid. I grew up in rural Minnesota. This is going to help a lot of folks across rural Minnesota.
All right. Thank you so very much for being here tonight. Thank you.
Thank you.